One of the criticisms of the government response so far is that officials, top officials, have said things that turned out afterwards not to be true. Right. Take a look at these.
Okay.
I have no doubt that we'll stop this in its tracks in the U.S.
Every hospital in this country has the capability to isolate a patient.
I shook hands with, hugged, and kissed, not the doctors, but a couple of the nurses, and I felt perfectly safe doing so.
Doctor, how do you explain all of these misstatements or overstatements from top government officials?
Well, I'm not so sure, Chris, that they're misstatements and overstatements. When Dr. Frieden said we can stop this in his tracks, he was talking about an outbreak. And what was applied to that was the fact that
three people, two more people got it.
No, two more people were infected in a situation in which they were at risk. What Dr. Frieden was talking about was an outbreak in the public. Now, we certainly are not happy at all that those two nurses were in danger and actually got infected, but that is strictly not an outbreak.
October 3rd, Lisa Monaco says every hospital in the country can isolate a patient. Look, without relitigating each statement, clearly there was a sense of certainty that was being conveyed which has not been lived up to.
Right, exactly, and that's unfortunate, and I think what we need to do right now is to make sure that when we talk about things, that we talk about them, there aren't absolutes. You want to have a delicate balance between assuring the American people, but not scaring them with the fact that there may be a risk. So what we do right now is that nothing is completely risk-free. And that's what people need to understand. But the relative risk of things, what people need to understand, is very, very small. Never zero, Chris, never zero, but very small.